Hello, everyone. My name is Andy Pope, and I have with me Dr. Mary Bassett.
Thanks very much, Andy.
Let's jump right in then. Why do you think this pandemic is affecting communities of color at such a much higher rate?
We don't have national data available to us yet. Nonetheless, the data that we have show a clear pattern that Black and Latinos are at higher risk of becoming sick with the novel coronavirus, having COVID-19, and dying of it. And they relate to two things. One, the risk of getting infected with this novel coronavirus and the risk of dying of it. Now, I like to think of those separately. And the risk of getting infected have to do both with the conditions of people's lives and also with their capacity to seek medical care. And the risk of dying from it have to do with the many common conditions that affect communities of color more commonly than the white population.
If you could say a little more about what role these factors play in.
Well, the first thing that I should do is reiterate what the Surgeon General said, is that these differences in patterns are not genetic or biological in origin. They are tied to the way people live, which are often sort of under the heading of the social determinants of health. And that means the kind of job you have, the kind of wage you get for that job, the type of benefits that you get with your job, where you live, and the level of crowding in your home, and how you get to and from work if you have a job which you can't work remotely. And all of these often make the advice that we give people, stay 6 feet away, wash your hands frequently, advice that's very hard to follow. These may determine their risk of not seeking healthcare promptly or continuing to be out in the public while unwell.
Well, this has been an interesting conversation with you, Mary. I've enjoyed meeting you and talking about these things.